The fighting is more damaging, deadly, and protracted. But if all of us can do what we can, the fight is over more quickly and without as much death and economic destruction. Now, when I was deployed to a war for a year, I missed birthdays, Thanksgiving, and Christmas with my wife and my family. And that was hard, but I knew it was part of something bigger than myself. My family knew that serving in the armed forces meant sacrifice, and that by our sacrifice we were contributing to the idea of a United States, and that the collective good and service above self was important. And that's where we are today, and this is no doubt a war. There's more than 250,000 people, Americans, that have died. We have hospitals without room to take care of patients, and healthcare professionals who don't know what else they can do. Tens of millions of Americans are out of work or worried about their economic future. All of us have to do what we can do. So on behalf of our healthcare staff throughout St. Louis, I really want to thank everybody who adjusted their Thanksgiving plans to try and keep the virus from spreading. I know many thousands of you took extra precautions and stayed home to keep others safe. And again, thank you for all that you're doing to protect yourself, your family, and the community, as well as the hospitals in the region. If you did go on a trip or went to a large family gathering, we're asking you to assume that you've been exposed to the virus and to self-quarantine. If you do that even now, we have a much better chance of slowing the spread and letting our healthcare systems get caught up. Because we continue to see too many people getting sick and having to come to our hospitals. And if the numbers don't go down very soon, we may not be able to keep up. We'll continue to have to look for other places to treat patients outside of our region. We'll continue to have to make decisions about who gets care and who can't get care because there's not enough space or staff. I was at one of our hospitals on Friday walking around and speaking with our staff, and they continued to feel overwhelmed. A critical care doctor told me that there were COVID patients on the floor that during normal times would be in the intensive care unit, but because there was no room available, they had to manage them on the floors. So in effect, we've already begun to alter our care standards because of the volume of patients. In short, I'm asking everyone in the area to recognize the hospitals they have come to know and depend on might not be able to help them in a couple of weeks. Our hospital staff will continue to do our best, but the numbers are likely to be just too big to care for everybody.